Welcome back to the deep dive. We're here again to, really get under the skin of some fascinating topics. So imagine this for a second. You're trying to do something incredibly delicate, maybe like building a tiny ship in a bottle, or threading a needle, perhaps, but you have to do it through a keyhole.
That's a great analogy.
It sounds impossible, right? But that's kind of the challenge surgeons face every day with laparoscopic surgery. It's this paradox, super intricate work, but done remotely.
It really is. It's an extraordinary feat when you think about it. Engineering, skill,
Mm.
it all comes together.
And that's exactly what we're going to unpack today. Our mission, really, is to take a proper deep dive into the world of laparoscopic cutting and dissecting instruments. These are the tools that make it all possible.
Yeah, they're not just smaller versions of normal surgical tools, are they?
Not at all. They're highly specialized. Think of them as the scalpels and scissors designed specifically for minimally invasive surgery, really cleverly designed to overcome the limits of working inside someone through tiny little holes.
Right. Indirect access changes everything.
So we're here to give you that front row seat to understand the how and the why behind these, frankly, remarkable tools. And why should you care? Well, because understanding these isn't just about learning names. It's about grasping a fundamental shift in how surgery is done.
Absolutely. A shift in philosophy and technology.
Exactly. It lets surgeons perform procedures, divide tissues, separate delicate layers, all with incredible control and minimal trauma. Things that were just, unimaginable not that long ago.
A generation ago, yeah.
So this deep dive, it's your shortcut to understanding the ingenuity behind it all. So lean in. This is where it gets really interesting.
It really does. Because these instruments, they're essentially extensions, aren't they? Extensions of the surgeon's own skill, their will, almost. They have to compensate for some really fundamental challenges in laparoscopy. You mentioned the keyhole.
Yeah.
Well, the core challenges really boil down to two big things. Those tiny incisions, obviously, and, crucially, the massive reduction in direct tactile feedback, that sense of touch.
The feel of the tissues.
Precisely. In traditional open surgery, the surgeon has this wide view. They can use their hands, feel the texture, the tension.
They know exactly what they're touching.
Right. But in laparoscopy, you're working through ports sometimes just millimeters wide. The view is limited to the camera, and that direct, nuanced, physical touch, it's almost entirely gone.
Wow. So how do they even know what they're dealing with if they can't really feel it?
Well, that lack of direct feedback, it's a huge paradigm shift. Imagine trying to tell the difference between, say, healthy tissue and tough scar tissue,
Okay.
or maybe even a subtle tumor. But you can only see it on a screen, and you're interacting with it using these long, rigid instruments.
So you're flying blind, in a sense, tactilely speaking.
Pretty much. You become incredibly reliant on visual cues, color, how the tissue looks, how it moves when you push it.
Uh-huh.
And you also rely on the subtle resistance you feel transmitted back up the instrument shaft. So the instrument design becomes absolutely
It
critical.
has to be perfectly engineered.
Now, every single millimeter, from the handle the surgeon holds right down to the tiny tip working inside the body, it all has to be designed to sort of translate that interaction with the tissue back to the surgeon to replace what their hands would normally tell them.
That sounds like a massive engineering challenge.
It is. Translating complex, multisensory input into something visual and mechanical.
Mm-hmm.
It's not trivial at all.
So it's not just about making small tools. It's about making tools that act like bionic senses for the surgeon.
That's a good way to put it.
Sure.
A proxy for their senses, yeah.
Yeah.
Projecting their intent, receiving feedback.
Okay, so given all the tiny space, the lack of direct feel, the need for precision must be just off the charts. What happens if something goes slightly wrong?
Exactly. Maximum precision, minimal tissue trauma, reliable control. These aren't just nice-to-haves. They're absolutely fundamental, non-negotiable.
Because the stakes are so high.
Immensely high. You're working in this confined, delicate space, critical things, major blood vessels, nerves, organs. They're often right there, millimeters away.
Right next door.
So even a fraction of a millimeter of unwanted movement or a cut that's slightly off, the consequences can be significant, catastrophic even.
Like what sort of consequences?
Well, you could cause life-threatening bleeding, permanent nerve damage, organ failure. The instruments have to be incredibly stable, predictable, responsive. There's just no room for error, no room for brute force.
It's all about finesse.
The entire philosophy is about getting the job done with the absolute minimum disruption to everything else. That meticulous approach defines modern, minimally invasive surgery.
That really highlights the shift. You mentioned open surgery. I can picture a surgeon using their fingers, maybe a blunt instrument to just gently push tissues apart. Blunt dissection, right?
That's right.
But you obviously can't get your fingers through a 5 millimeter port, so how did they overcome that specific limitation?
You've hit on a key difference. In open surgery, yeah, the hands are often the primary tools for separating things, feeling resistance.
Yeah.
Laparoscopy forced a complete
A
rethink.
whole new approach.
It shifted from being hands-on direct contact to being almost entirely tool-driven. So where open surgery might use fingers or maybe larger tools to push tissues apart along their natural lines,
Hmm.
laparoscopy needed slim, long-shafted instruments designed specifically to do that job remotely.
So they had to invent tools to mimic the hand's function.
Essentially, yes.
Mm.
Tools that can perform sharp dissection cutting, but also blunt dissection, or even use energy to help separate tissues, all effectively from a distance.
Mm.
They're trying to replicate the dexterity, the fine control, the feel, the strength of a human hand, but at the end of this long, thin rod.
The engineering must be incredible.
Oh, it is. Robust yet flexible materials, precise gears in the handle, ergonomics that translate big hand movements into tiny tip actions. It's complex stuff.
And it's not just about cutting, is it? The research you shared mentions three sort of pillars for these tools.
Yeah.
Cutting, separating tissue planes, and this really interesting one, dividing things while stopping bleeding at the same time. Simultaneous hemostasis.
That's right. Those three pillars really cover the full scope. It's much more than just making an incision.
Okay, let's break those down. First, cutting tissues. Seems obvious, but what kind of cutting are we talking about in this context?
Well, it might seem straightforward, but think about doing it precisely in that confined space. We could be talking about dividing adhesion scar tissue, basically.
Like stuff sticking together that shouldn't be.
Exactly. Bands of scar tissue from old surgery or inflammation, gluing organs together. Cutting those precisely frees things up, relieves pain, fixes obstructions. It's like carefully untangling a web without damaging the main structure.
Delicate work.
Very. Or sometimes you need to cut the peritoneum of that thin lining inside the abdomen just to get access to what's underneath. It's about making very deliberate, precise cuts to expose or remove something specific, always avoiding collateral damage.
Surgical liberation, carefully done.
Yeah.
Okay. And the second pillar, separating tissue planes. That sounds like creating pathways.
That's a great way to think about it. Creating clear, safe pathways.
Ah.
It means carefully pushing or slicing through layers, could be fat, fascia, connective tissue, to get to the important stuff underneath.
Like peeling an onion layer by layer.
Sort of, yeah.
Yeah.
Imagine you need to find a specific wire hidden under layers of insulation. You have to peel those back carefully without nicking the wire or anything else.
Makes sense.
In the body, those layers might hide blood vessels, nerves, ducts, things you need to see clearly, protect, or maybe prepare for division later on. Separating planes properly helps you see better, stops you injuring things accidentally, and creates that vital working space, which is always tight in laparoscopy.
So it's like navigating the body's architecture.
Precisely. Methodical, strategic navigation.
And then the third pillar, the one that sounds like a real game changer. Dividing vessels or ducts with simultaneous hemostasis. Stopping the bleeding right as you cut. Why is that so critical in this closed environment?
Ah, yes. This is where you see a major leap in laparoscopic innovation. Stopping bleeding hemostasis is crucial in any surgery.
Right.
But in open surgery, you might cut a vessel, then grab a clamp, tie it off with suture, maybe use cautery. Several steps, several
It
instruments.
takes time.
A lot of time. And in the confined space of laparoscopy, doing that for every little bleeder, it's incredibly cumbersome, time-consuming, and frankly increases risk. Every instrument swap is a potential problem.
Okay, I see.
So tools that can cut and stop the bleeding at the very same time, that offers huge gains in efficiency and safety. It's vital.
How so?
Well, first, it saves a massive amount of operating time. Second, it drastically cuts down on blood loss, which is safer for the patient, less need for transfusions, faster recovery. And third, and this is critical, it keeps the view clear. Imagine trying to do that intricate keyhole surgery if there was blood constantly pooling and smudging the camera lens.
Impossible. You wouldn't be able to see anything.
Exactly. So simultaneous cutting and hemostasis isn't just convenient. It's a cornerstone of modern laparoscopy. It allows surgeons to keep things clean, controlled, and keep moving forward. Two steps become one seamless action.
Okay, that makes a lot of sense. Let's get into the specific tools then. Starting with the basics, but still essential. Scissors. Even with all this high-tech stuff, basic laparoscopic scissors are still fundamental, right?
Absolutely. You'll always find scissors in a laparoscopic setup. They remain incredibly versatile workhorses. The design philosophy is all about translating that precise scissor action through the long shaft, making up for the lack of direct feel.
So sharpness, good handling.
Sharpness, ergonomics, and often, yeah, the ability to connect to energy sources, which we'll get to. But let's look at a few key types first.
Okay.
First up, probably the most common name you'll hear, Metzenbaum scissors.
Metzenbaums. Okay, what are they like?
They're usually slim, often have curved blades, and the tips are quite delicate. They're really designed for fine tissue cutting.
What counts as fine tissue?
Think delicate membranes like the omentum, thin layers like the peritoneum, or those small wispy adhesions we talked about. Things that need a very clean cut, no tearing.
And the curved blade, is that important?
Yeah, the curve is really helpful. It allows for more ergonomic cutting in tight, curved spaces, which is most of the abdomen or pelvis. It lets the surgeon follow the body's natural contours more easily, better angles, less twisting of the wrist.
Matching the tool to the anatomy, like an artist's brush, sort of.
That's a nice way to put it. Yeah.
Okay, what about hook scissors? The name suggests something pretty specialized.
They are specialized. They have this distinctive hook shape at the tip of one or sometimes both blades, often very fine, very sharp.
And what's the hook for?
It allows for really precise snipping in very narrow or awkward spots. Imagine you need to cut a tiny band of tissue wrapped around something delicate, like a small vessel or duct,
Okay.
or maybe get into a deep corner where straight blades just couldn't reach safely. The hook lets you gently catch or lift just the target tissue, isolate it from what's underneath or nearby, and then snip it.
So it gives you extra control and safety in tight spots.
Exactly. Ensures you only cut what you intend to cut.
Got it. And then you have endo scissors. Sounds like a general term.
It often is used more generally. They're the long-shafted scissors, typically used for more general cutting tasks. A key feature many have is that they're rotatable.
Rotatable, why is that useful?
That's a huge ergonomic plus in laparoscopy. Think about it. In open surgery, you can move your whole arm, wrist, hand to get the right angle.
Right.
But in laparoscopy, the instrument goes through a fixed point, the port. If your scissor blades aren't angled correctly for the tissue,
You'd have to twist your arm awkwardly.
exactly, which leads to fatigue, maybe even tremors, definitely less precision.
Right.
Or you waste time repositioning everything. With rotatable endo scissors, you just turn a dial on the handle and the tip rotates.
So you adjust the blade angle without contorting yourself.
Precisely. Much more control, more flexibility, less fatigue, more comfort. Makes them the go-to for many general cutting needs.
And this is where energy often comes in too, right? Many scissors are monopolar compatible. We've touched on monopolar energy, but how does connecting scissors to it actually help? What's the big win?
It's a massive win for efficiency and safety. Monopolar compatible means you can plug the scissors into an electrosurgical unit.
Okay.
When the surgeon activates it, electrical current flows to the tissue right at the scissor tips. This generates heat, which can be used to cut tissue cleanly with less force, or to coagulate small blood vessels, stop them bleeding.
So it does both. Cuts and stops bleeding.
Yes, and that's the biggest advantage. Reducing instrument exchanges. Instead of cut with scissors, put down scissors, pick up cautery tool, zap the bleeder, put down cautery, pick up scissors again.
Tedious and risky, maybe, dropping things.
Potentially, yeah. More movement, more time. With monopolar scissors, you do both cut and achieve hemostasis with one instrument. Saves time, reduces risk during swaps, keeps the view clearer because there's less bleeding.
One tool, two jobs. Huge efficiency boost.
It really is. A brilliant combination of mechanical cutting and energy.
Okay, let's move from scissors to dissectors. Now, these sound interesting, described as having fine jaws and pointed tips, for both blunt and sharp dissection. Why is having both capabilities in one tool so useful laparoscopically?
That dual capability is incredibly powerful because it just gives the surgeon more options with a single instrument. And minimizing instrument changes is always a goal in laparoscopy.
Right. Less swapping.
So blunt dissection is gently separating tissues along their natural lines, easing them apart. Sharp dissection is making a precise cut. A good dissector lets you do both.
So you can tease things apart gently.
Yeah, use the jaws to tease apart layers, create space, expose things.
And then if you hit something tougher, you can cut it.
Exactly. If you find a specific tough band or membrane that needs dividing, you can use the pointed tip for a precise sharp cut, or maybe even use it with energy to cut and coagulate. That versatility means fewer instrument changes, a smoother workflow, and the ability to adapt to different tissues easily.
And within dissectors, the Maryland dissector comes up again and again. Most commonly used, highly versatile. What makes the Maryland the superstar?
The Maryland really is the workhorse. Its popularity comes down to just how versatile and well-designed it is. The jaws are engineered for really good grasping, holding tissue, moving it around, retracting it, essential for getting a good view.
Okay, so it grabs well.
Grabs well, yes.
Yeah.
But beyond that, its fine jaws, often slightly curved, and that pointed tip are perfect for both delicate blunt dissection and precise sharp dissection.
So it does the grasp, the blunt, the sharp.
And crucially, most Marylands are also monopolar compatible.
Ah, so it does energy too.
Yes, so with one single instrument, the surgeon can grasp, dissect bluntly, dissect sharply, and coagulate bleeders or even cut with energy.
Wow. Okay, I see why it's everywhere. It's like a Swiss Army knife.
Pretty much, it handles so many steps in almost any procedure, minimizing those swaps. That's why it's indispensable.
Makes total sense. Now, the right angle dissector sounds very specific. Distinctive angled tip, noted as ideal for encircling vessels or ducts, especially in gallbladder surgery. Why is circling around something like a vessel so important?
The right angle is a perfect example of specialized design solving a specific problem. That angled tip lets the surgeon carefully get around a tube-like structure, a vessel, a duct, and then bring the tip back, essentially looping around it.
Okay, so it hooks around it.
Right. And that encircling action is absolutely crucial for safety and control. Once you've got something encircled, you know you've isolated it properly. Then you can prepare for the next step, which is usually irreversible, like putting clips on it, sealing it with energy, or tying it off.
So it confirms you've got the right thing.
Exactly. In gallbladder surgery, for instance, you must correctly identify and secure the cystic artery and cystic duct before you remove the gallbladder. The right angle lets you get safely behind them, making sure you've isolated only those structures and not, say, the main bile duct or a major artery nearby.
Which would be...
Very bad. Life-threateningly bad. So encircling is about positive identification and control before you commit to dividing something. It's a critical safety step.
deliberate verification. Got it. And then there's the hook dissector. Shaped like a hook, fine tip, used for lifting and separating. How does just lifting tissue help so much?
The hook dissector is brilliant when you need to lift tissue precisely to see what's underneath. Remember, visualization is everything in laparoscopy, but layers of tissue can easily hide important things.
Like looking under a rug.
Kinda, yeah. Imagine trying to work under a delicate structure you can barely see. You need to lift it gently to see clearly and work safely. The hook allows you to do that, gently lift tissue to create space, improve your view of what's beneath, a nerve, vessel, tissue plane.
And better visibility means less chance of accidental injury.
Absolutely. By lifting and separating, you create a clearer, safer surgical field without causing trauma. It allows for a more confident, precise dissection underneath.
Okay, so we've covered the mechanical workhorses, scissors, dissectors, hooks. Now we shift gears into specialized tools that really lean on electrosurgery. We mentioned monopolar energy. What are the key things to keep in mind when using electricity like this laparoscopically?
Right, this is where we integrate energy sources more deliberately. With monopolar electrosurgery, the current flows from the instrument tip through the patient to a grounding pad. The key considerations laparoscopically are ensuring that energy is delivered precisely where you want it in a controlled way, especially in a potentially wet environment, and minimizing any unintended heat spread to surrounding tissues.
Keeping the energy focus.
Exactly. Concentrating the effect at the tip for surgery while making sure the current returns safely. It's a careful balancing act for efficacy and safety. Assuming our listeners get the basic monopolar idea, the focus here is on the application.
Got it. So, first tool in this category, the monopolar hook. Sharp angled tip. Excellent for dividing peritoneum and adhesions. We keep coming back to adhesions. Why are they such a common problem, and how does that angled hook design help tackle them?
Adhesions are incredibly common, yeah. They form after surgery, infection, inflammation, basically scar tissue sticking things together. They can cause chronic pain, blockages like bowel obstruction, and make future surgeries much harder and riskier because the normal anatomy is distorted.
So surgeons often have to deal with them.
Very often.
Yeah.
And the monopolar hook is really good at it. The sharp tip lets you engage the adhesion precisely, whether it's thick or thin. And that angle design often lets you get under the adhesion, lift it away from whatever it's stuck to.
Create some space.
Right, lift it slightly, then apply the monopolar current. This cuts the adhesion cleanly while simultaneously coagulating any small blood vessels within it. Immediate hemostasis.
Which is vital if that scar tissue is vascular.
Very vital. Scar tissue can bleed a lot, obscuring your view quickly. The hook allows controlled division with minimal bleeding, helping to free up organs, restore anatomy, and create safe pathways. The angle gives it that mechanical advantage for lifting and isolating.
And distinct from the hook, there's the spatula dissector with a flat tip. How does that flat shape let it push, spread, and coagulate? Where is that useful?
The spatula is clever because that flat tip gives it a unique skill set. It can be used very gently to push tissues apart or spread them. It's a form of blunt dissection, really.
Like using a piney trowel?
A bit like that, yeah. It's great for carefully opening up natural tissue planes, dissecting through soft connective tissue, or just nudging structures aside to get a better view without immediately cutting. It helps you find the path of least resistance.
And it coagulates too.
Yes, because it's also monopolar compatible. So as you're gently pushing and spreading, if you encounter tiny bleeders, you can activate the energy and coagulate them right there.
Maintaining that clear view as you go.
Exactly. Keeps the field dry, enhances visibility. It's really valuable when you're working near delicate things and need to carefully separate layers before making a cut, or maybe clearing away fatty tissue, all while managing any little oozing. It's precise, multifunctional for gentle work.
Okay, fascinating. Now, let's really step into the high-tech zone. Moving beyond those tools to advanced energy devices, these sound like the next level using light, sound, heat in very sophisticated ways. What's the big leap here compared to the tools we've discussed?
This is where surgical tech gets really sophisticated. These advanced devices are a significant jump because they go beyond simple cutting or basic heating. They use highly controlled energy, ultrasonic vibrations, advanced bipolar radio frequency to cut and seal tissue with much greater precision and efficiency.
And less collateral damage.
That's a key differentiator, yes. They often achieve a secure, even permanent seal or division with minimal damage to surrounding tissue, sometimes working at a molecular level. This allows for faster, safer surgery, especially complex procedures. They solve problems of tissue division and vessel sealing in ways the other tools just can't.
Okay, let's look at the first one. The harmonic scalpel, it uses ultrasonic aspiration. How on earth does that work, and why is its key advantage, minimal thermal spread, so important?
The harmonic is genuinely ingenious. It doesn't use electricity to cut tissue directly. Instead, its blade vibrates incredibly fast, about 55,500 times per second, ultrasonic speed.
Wow.
When that vibrating blade touches tissue, the friction generates intense localized heat very quickly. This vaporizes water in the cells and denatures the proteins.
Denatures proteins, like cooking.
In a way, yes, but very, very precisely. The protein denaturation causes the tissue to coagulate and then essentially break apart. So you get simultaneous cutting and hemostasis from the mechanical vibration itself.
Okay, and the minimal thermal spread.
Right, that's the crucial advantage. Because the effect is mainly from friction and vibration, the heat generated stays very localized right where the blade touches. It doesn't spread sideways into adjacent healthy tissue nearly as much as, say, traditional electric cautery.
And why is limiting that spread so vital?
Because that collateral damage from heat spreading can cause problems. Slower healing, more inflammation, nerve damage if nerves are nearby, even delayed tissue death, which can compromise the surgery. By minimizing heat spread, the harmonic protects healthy tissue, leading to faster healing, less pain, fewer complications. It's very gentle, yet effective, especially in delicate areas.
Surgical finesse, really protecting tissue.
Okay.
Next up, ligature, described as an advanced bipolar device. What's the tech behind advanced bipolar, and how does it manage to seal vessels up to 7 millimeter? That sounds like quite a large vessel. What does seal mean here?
Ligature really represents the peak of advanced bipolar energy. Standard bipolar just flows current between two jaws to cook tissue. Ligature is much smarter. It uses a specific radiofrequency waveform combined with pressure, and it has feedback control.
Feedback control.
Yeah, it constantly measures the tissue's resistance to the energy flow, impedance, and adjusts the energy output accordingly. This delivers exactly the right amount of energy and pressure between the jaws to create a permanent, very strong vessel closure.
So what does seal mean at the tissue level? Is it just cauterized?
It's more than just cautery. It's actually vessel fusion. The energy and pressure denature the collagen and elastin in the vessel wall, melting them together, essentially. It transforms the vessel wall into this fused, translucent structure, like a biological weld.
What biological weld? Wow.
And the system ensures this fusion is reliable across the whole diameter. It's often stronger than a surgical clip or tie.
And it can handle vessels up to 7 millimeter. Why is that size significant?
That 7 mm capability is huge. It covers most of the medium-sized arteries and veins you encounter in major abdominal or pelvic surgery, like bowel resections, hysterectomies, cancer surgeries.
So it replaces a lot of manual tying or clipping.
Exactly. It drastically reduces the need for sutures or clips to control bleeding from these significant vessels. This saves an enormous amount of time, means less foreign material left inside the patient, and just streamlines the whole dissection process. It lets surgeons keep their momentum safely, makes complex surgery faster and safer.
That is incredibly efficient. Biological welding. Amazing.
Okay, and finally in this category, the Thunderbeat, highlighted as a hybrid device combining ultrasonic cutting with bipolar sealing. So it merges the harmonic and ligature concepts.
Precisely. Thunderbeat is the ultimate hybrid, integrating both of those distinct, powerful energy types into one handpiece. You get the ultrasonic cutting, with its precision and minimal thermal spread like the harmonic, and you get the advanced bipolar sealing for larger vessels, like ligature, all in the same instrument. So the surgeon has both options available instantly.
Literally at their fingertips.
Yeah.
This gives massive synergistic benefits in terms of speed and versatility.
How so?
Well, fewer instrument changes for starters. Big time saver. A surgeon can delicately dissect fine tissues with the ultrasonic function, then immediately encounter a larger vessel and switch modes to seal it securely with the bipolar function, all without putting the instrument down.
Adapts to whatever they encounter.
Exactly. It handles a huge range of tissues and situations, delicate planes, tough vascular bundles, makes it incredibly versatile for complex operations where you need both precise dissection and reliable, strong hemostasis. The engineering to get both systems working perfectly in one tool is remarkable. Streamlines the whole workflow.
Incredible. It really shows the journey these tools have taken. But with such powerful, precise instruments, especially with that limited direct feedback, safety must just be drilled into surgeons constantly. Oh, absolutely. Paramount. You cannot overstate the importance of safety. These tools are powerful, yes, but using them safely requires constant vigilance, deep anatomical knowledge, and interpreting those subtle cues you get back.
Because you don't have that immediate warning from touch if something's wrong.
Exactly. So sticking to strict safety protocols isn't just recommended, it's fundamental. The core principle is always maximizing patient safety, minimizing unintended harm.
And the research outlines some key guidelines. The first, maybe the most critical. Always confirm anatomical planes before dividing tissue. How do surgeons actually do that reliably without direct touch? And what happens if they skip that step?
This is rule number one, especially in laparoscopy. Confirming anatomical planes means being absolutely certain about the layers you're working between. What's above, what's below, what's right next door, before you make any cut.
So how do they confirm? Through meticulous, systematic dissection, using instruments to gently pull tissues apart, traction and countertraction, to see the layers clearly, sometimes gently probing with an instrument, using different energy settings perhaps, sometimes even intraoperative imaging like X-rays with dye for bile ducts if needed.
And the risk if they don't confirm.
The risk is accidentally cutting something vital, a major blood vessel causing massive bleeding, a critical nerve causing paralysis, damaging the bowel, the ureter, the bile duct, leading to severe complications, long recovery, potentially even death. Diligent confirmation is the absolute bedrock safeguard against those preventable disasters. Certainty before commitment.
Certainty before commitment makes sense. And related to that is the advice to prefer blunt dissection in critical areas. Why is gently separating safer than cutting near important structures?
Blunt dissection teasing or pushing tissues apart is generally safer near critical stuff for a few reasons. First, it tends to follow the natural existing pathways between tissues, which is less disruptive than slicing across them. Second, and really important laparoscopically, it gives you more feedback, even through the instrument. If you're bluntly dissecting and hit unexpected resistance,
It tells you something's there.
exactly, it's a warning sign. You might be pushing against a vessel or a nerve you shouldn't cut. A sharp blade, however, might just slice right through it before you even register that resistance.
Too late.
Potentially, yes. So in critical areas like around major blood supplies to organs or near important nerves, the slightly slower, more cautious blunt approach lets you identify and protect those vital structures first. Safety over speed when the stakes are highest. Understand the anatomy before you divide it.
The surgical look before you leap. Okay, another very practical point.
Right.
Replace dull scissors, promptly blunt blades, increase the risk of tearing and bleeding. What difference does a dull blade actually make in the moment?
Oh, a dull blade is a real problem. Sharp scissors glide through tissue cleanly, minimal effort, precise cut. A dull blade, you have to use much more force.
Which isn't good.
No. That extra force crushes the tissue edges instead of cutting them cleanly. That means more trauma, potentially slower healing, more inflammation, and those ragged edges, they bleed more because vessels get torn instead of cleanly cut.
Making it harder to see.
Exactly. Obscures the view. Plus, pushing harder increases the risk your hand might slip, causing accidental injury nearby. In laparoscopy, where your view is everything, unnecessary bleeding from dull tools is a major complication, slows things down, increases risk. Sharp instruments are a basic but critical safety factor.
Right. And finally, for the advanced energy devices, limit activation time to reduce lateral thermal injury. Even the fancy ones with minimal spread can cause issues if used too long.
Yes, absolutely.
Mm.
Even with harmonic or ligature, designed to minimize heat spread, if you keep the energy activated for too long, that heat can still gradually creep sideways into adjacent healthy tissue. That's lateral thermal injury or collateral thermal spread.
Unintended heat damage.
Right. You might not see it immediately, but that cellular damage can cause delayed problems.
Like what?
Poor wound healing, tissue dying off later, necrosis, more scar tissue forming, maybe nerve damage if nerves are close by.
So surgeons need to be quick with the trigger, so to speak.
They need to be disciplined. Use short, controlled bursts of energy. Activate only for the minimum time needed to cut or seal effectively. This technique minimizes the heat dose to surrounding tissues, leading to better outcomes, faster recovery, fewer hidden complications. It's about using the power responsibly.
What an incredible journey through these tools today. We've gone from, the essential scissors and dissectors, versatile tools, through the specialized hooks and spatulas using electrosurgery, right up to the really cutting-edge energy devices, harmonic, ligature, thunderbeat.
It's a whole spectrum of innovation.
It really is. It makes it so clear how these instruments are truly the cutting edge of laparoscopy. They're what allow these major operations to become minimally invasive with all the benefits for patients' precision, faster recovery. It's amazing.
It's a fantastic testament to ingenuity, isn't it? That constant drive for surgical excellence, pushing boundaries to minimize disruption while maximizing effect. The evolution is ongoing.
Absolutely. Which leads me to a final thought, something for you, our listener, to chew on. We've talked about how these tools compensate for lost touch and sight. But looking ahead, what's next? What future innovations might go beyond compensation? Think about robotics with true haptic feedback, feeling what the instrument feels. Or AI vision systems that highlight hidden nerves or predict how tissue will react in real time.
Yeah, intelligent instruments.
Could we get instruments that actually feel and see on their own, adapting to microscopic tissue changes? How much more sophisticated could these already remarkable tools become?
Those are really exciting frontiers. Moving beyond mimicking senses to perhaps augmenting them or creating entirely new sensory inputs for the surgeon, it could transform surgery again.
Fascinating stuff to think about. Well, that's all the time we have for this deep dive. Please join us next time on The Deep Dive. We'll be continuing our look at laparoscopic instruments, focusing on clamping and occluding instruments.
The tools for controlling bleeding and securing structures, equally vital.
Definitely. You won't want to miss it. Thanks for diving deep with us today.